go?
Yeah.
Perfect. Okay. Well, hello everyone. My name is Katelynn. For those who do not know me, I am in my last year of my biosci degree, hopefully becoming a pediatric dentist one day. But today we're going to be talking about a topic that I really enjoy talking about, which is neurodivergence. So we're going to be talking about the intersection of AI and technology for neurodivergence, specifically autism, and how that can work for the diagnosis, the support, the interventions, and the empowerment of neurodivergent folks. So as a brief outline, I'm going to try and really solidify what neurodivergence is and autism is in this beginning section, and then we're going to look about the past, current interventions, and what I think the future could look like for neurodivergent people. So as a quick little question, does anyone actually know what neurodivergence is? Does anyone have a little definition? It's okay if you're wrong, I'm here to educate all of you on this, so it's fine. No guesses? Okay, we got a quiet crowd today, that's completely fine. So this is a definition from the Oxford Languages textbook. It's saying it's differing in mental or neurological function from what is considered normal or typical. So basically, not neurotypical. Okay, let's keep those definitions in our head. We're going to be talking about those a lot. So there's a lot of different examples of neurodivergence. So that can be with someone who has ADHD like myself, someone who is autistic, or someone who has dyslexia. Now, as a secondary question, since we're focusing on autism, does anyone actually know what autism is?
Yes.
Go ahead.
So
of course, the doctor. Yeah, okay, no, I'm kidding. Go ahead.
I'm just giving a
No,
very basic idea. So it's basically a communication disorder, which can be diagnosed in children, presents with loss of eye contact and reduced social interaction.
Yeah, very good definition. I am going to actually hand off the definition to a video from an autistic advocate named Katelynn. She has autism herself, so I think she's going to be better at explaining it than I can. So I have a video. Let me see if it'll play. Oh my god. Oh, please, please. Oh, of course the audio is not going to work.
Oh.
Well, we can see the captions, so...
Each type of brain has its own strengths and weaknesses. Dry erase markers are perfect for whiteboards, but dry out easily on paper. Autistic brains are usually good at noticing patterns, and they often have a special topic that they love to learn and talk about. Autistic brains can also have a hard time making friends and dealing with change or loud noises. Sometimes people with autistic brains might work with a therapist or use special tools like headphones to help them with things that are hard. Here are some suggestions for talking points you can use in this discussion.
So this is specifically for kids, but again, it gives a really brief overview for what autism is and a very good analogy to explain it to children and just people in general. I'm trying to find the connection to my other... I'm so sorry, gang. There we go. So again, Katelynn went through these very well, but here are some features of autism that you may see. So issues with social and emotional reciprocity, nonverbal communication, issues with maintaining relationships, intense interest, which could be called hyperfixations, if you guys have heard that term. So repetitive speech, movement, use of objects, which could be through stimming, preference for sameness, so routines, and reactivity to sensory environment. She briefly talked about like headphones and those sort of supports, but those are examples of what features of autism are. It's also very important to note that autism is not just, one binary thing. Each person with autism is going to have certain strengths or challenges in different areas. So you might have heard it be called the autism spectrum disorder before. It's not, again, this linear, oh, I have more autism than the next person. It's more of a wheel, right, of different traits, and you might have more in one area and less than another. Yeah, so some people might need more significant daily support while others might not need any at all. Here are some examples. We're not going to play these, but again, just really hitting home what some problems for people who have autism are. One of them is dental phobia. So if anyone's been to the dentist before, which I think we all have, it's very loud. It's very overstimulating, like really bright lights, really loud noises. Those would be overwhelming for autistic individuals. On top of that, Katelynn also discusses inappropriate autistic behavior. So one problem that an autistic individual may have is understanding social norms. So they might be doing inappropriate behaviors in public. So that's another problem that they may face. So we're gonna go into the real meat and potatoes now and talk about some interventions. So we talked about problems, but how have we adapted in the past to help autistic individuals, and how can we adapt to help autistic individuals currently and in the future. So in the past, here's some interventions that we have done. One of them is ECT, the other one is dietary changes, and the third one is ABA, or applied behavior analysis. So these first two kind of worked off of the model that autism is curable, right? Like the idea that we can cure autism by giving someone a diagnosis of, okay, we can just change their diet, autism is cured. That is not the way it is. Autism is more of an identity. Someone is autistic, right? It's a very different thing. So these were ineffective in the past. They were just harmful in general. The third one is ABA, or applied behavior analysis, which is looking at, so it was criticized in the past for focusing too much on compliance. So it was looking at a child with negative or harmful behavior and saying, don't do that, and not necessarily saying, okay, what does this person do? So not very helpful. We can kind of see that, right? And all of these interventions have kind of just helped try to facilitate autistic individuals to appear neurotypical, which doesn't necessarily work. They helped autistic individuals appear more neurotypical, but doesn't actually support their needs as people. So nowadays we're kind of switching to more of an affirming approach, right? Like we're saying, okay, these people are autistic, what can we provide for them to have a better quality of life? So this can align with advancements in AI, like because there's so many different ways to see autism, a personalized diagnosis may be very, very helpful. And on top of that, having this can create more opportunities for AI for tailored interventions for autistic individuals. So again, it's this big, broad spectrum of different challenges for some individuals and for others not. Okay. So, this is kind of like a mind map of some things I've seen in some papers. So some things we're currently doing. There's some papers that have been looking at diffusion tensor imaging, MRIs, looking at videos of communication skills and speech intonation and pacing, putting that on an AI machine model, and kind of having a diagnosis from that. It's really cool. And it really helps because traditional diagnosis kind of just looks at human observation, and this can be very long wait times. Like I think I talked about this in a previous course before, but the wait times for autism diagnosis are very long, and it's really easy. Well, you should be trying to tackle it earlier so then they have those supports and know what to do in particular situations. This can also, so it can look at behavioral data, speech patterns, eye tracking, movements to help clinicians with diagnosis. So this is actually already applied from this company called Cognoa, called Canvas DX. You can see it right here. Beautiful, wonderful, amazing. So it analyzes particular patterns from children who are playing, and it gives that into a machine learning software. It also combines healthcare practitioner questionnaires and parent questionnaires into machine learning software and then spits out different results. Cool. It would have been too easy for me to say that AI can be used for diagnosis, right? It would have been way too easy. So when you get diagnosed with autism, well, what do you do now? The software just gives you, okay, you have autism spectrum disorder. What happens past that? Well, we can actually use this even further and use AI to have or implement or give certain interventions to autistic people. So we kind of talked about this in a previous lecture with Dr. I won't go too much depth in this. This is a lot of math. I understand that. But we talked about this in a previous lecture with Dr. Greener with looking at the math of learning models and different types of learning models. But we can use the framework or the basis that we saw from Canvas DX and push it even further by looking at, okay, what is the different aspects of autism that someone is struggling with, and then provide them with support. So it's like an extra step of, okay, you have an autism spectrum disorder, what are different implementations or different assisted softwares could this person use past that? So personalized healthcare, which is something we've talked a lot about in class before. Yeah, so if someone who prefers visual learning, they may provide like a VR-based social training software to them, or those types of interventions. But this is my favorite section of the presentation. We get to talk about some things that are currently being worked on with AI and autism intervention. So some applications that we're currently working on. The first one is helping recognize facial expressions. And this is very difficult and very isolating for autistic individuals, because imagine you're like in a conversation with a group of people and we're all like having a good time, we're laughing, and someone makes a joke, and I actually, if I was an autistic individual, I didn't get it. That can feel very isolating. And sometimes having a conversation with people and maybe someone uses like irony or something, not irony, but if they're using something in a specific context, it could be misrepresented in my head, and it can cause a lot of like feelings of isolation. Isn't very nice. But there was some research from Alexander Wong from the University of Waterloo who created a facial expression classification system using AI and machine learning. So imagine I am an autistic individual and I'm talking to one of you neurotypical folks in a meeting. So we're online, we're on a little Zoom meet, and again, I don't understand what your facial expressions are really meaning, right? The AI can sort of track the facial software and give me a little emoji in the corner of my screen saying, okay, this is what this person is, the facial language of someone is saying. So it bridges that gap for autistic individuals. And the next one we're going to be talking about is AI as a bridge for socialization and AR and VR. So these are kind of like stepping stones for one another. They're kind of like similar, it's a similar thing. So this image on the screen is from the Peridot app, which is very interesting, if you can see that. It's a social assistant designed to facilitate communication for neurodivergent individuals. So again, what if I have a terrible conversation with someone? I don't really want to do that again. Like if it keeps repeating over and over, I might isolate myself and not be confident to talk to other people. So again, having like a controlled environment to be able to stimulate social situations is super duper helpful. So this is through AI, through a little phone avatar, but it can be, pushed even further to VR and AR environments, right? So again, creating a controlled setting, safe and repeatable exposure to social interactions without the pressure of real-world consequences. Very, very helpful. So here are some more that I was actually really interested in. Next is personalized learning. So autistic individuals might have troubles in school, right? Like learning may be different for them than a neurotypical individual. So being able to adapt curriculum for maybe examples that fit towards their hyperfixation, or autistic individuals may be really good at looking at patterns and doing that sort of thing. So maybe fitting the curriculum to that sort of approach may be better for them as well. But adapting it in the moment, like if someone's having trouble understanding, AI could then like fix the problem or go back on a certain concept to help them. It's like a personalized tutor in some ways. This is an image from a video from CNBC with someone from Khan Academy talking about how AI can be used helpfully in education. So very good video, but yeah. The next one we're going to briefly talk about is AI assistants. I don't know if you guys have been getting ads for this, but there's like something called Motion AI. I don't know if anyone's heard of it. No? Okay, maybe it's just me. Maybe they know their audience. But so Motion is actually an AI tool that helps with, structuring daily plans. So imagine you have a bunch of tasks on your list. If you're a neurodivergent individual like myself, I struggle with executive functioning, meaning I have a task, sometimes it's so overwhelming that I cannot break it down. So these AI softwares can help with, like scheduling things to make sure things get done and helping with reminders. Autistic individuals specifically have troubles with diverting from routine. So imagine something gets canceled, like a meeting one day, and you're like, oh no. As an autistic individual, that may cause a lot of dysphoria. So being able to have a software that kind of adds tasks for you is very, very helpful. So these are kind of all things that are currently going on, right? And here are some like pros and cons that I've kind of seen from these. Number one, again, we're going back to that diagnosis section. Faster diagnosis. Again, there's a long wait time for autism diagnosis, so it's helpful for clinicians to get a sort of like running start for that. I'm going to go back and forth. So diagnosis bias, if all of the data for the machine learning softwares is for, a particular type of autism, or if it's for like an extreme type of autism where people have difficulties with daily functioning, then the machine learning is only going to be picking up that kind of autism, right? And because it's such a large spectrum, it may be difficult, but It might also help with diagnosis bias. So if you guys didn't know, autism is actually primarily diagnosed in boys than it is girls, and that may be due to the DSM-5 criteria, but that may be also due to physician bias. So maybe the implementation of AI can help remove that sort of bias that physicians have. Next one is personalized support. Again, with those like educational learning softwares, being able to, fit it to each child is very important. Privacy. So if you have that emotional recognition software and you were the neurotypical, in this case, and I was the autistic individual, the consent there, like the AI is reading your facial expressions. Is there consent in that regard? And if there isn't, like what does that autistic individual do? Like it can make people uncomfortable, right, with that idea of privacy. The next pro we can kind of see is degree of autonomy and independence. Those autistic individuals who have trouble doing things on their own, they're gaining a sense of power from this, right? Like they can start, doing tasks on their own. They don't have to rely on other people as much. Speaking of that, some cons, over-reliance. We've talked about this briefly near the end of our lectures here, but looking at those AI avatars, the purpose of it is for them to use those tools and then to use that in real-life conversations with people, right? So what if an autistic individual was to just primarily use that as our source of socialization? That would not necessarily be what we want. We want people to be able to interact with others. So, yeah. We've looked at some current interventions, right? We've looked at all of these. How might the far future for autistic or neurodivergent individuals look? So, we often talk about helping autistic individuals kind of adapt to this neurotypical world, like having them needing to read our facial expressions and having them needing to do all of these sort of assisted softwares to be like a neurotypical person. But why don't we kind of start creating our own little world for neurodivergent people to thrive in? In fact, why don't we just all have our own little worlds? And I'll explain that really briefly. From the metaverse. So we've all heard of the metaverse before, right? I hope so, right? Yeah. So, but this offers a chance to create a tailored environment to suit individual needs for people with autism and just people in general. I'll give you a little example. Imagine you're an autistic individual who struggles going to school because of the bright lights, the loud noises, all of the sounds. What if they were able to, go in through a VR headset, be holographically present in some ways, and then be able on their side to turn down the lights or turn down the sounds without interrupting anyone else's learning environment. So again, tailoring it to individual sensory needs would be great. And this would also be great within a medical context for people who have anxiety going to the doctors. Imagine just being able, for a consult or something, being able to put a VR headset and be there with your doctor rather than having to, have the anxiety of physically going and doing that, yeah. Yippee! Yeah, I'm just making sure I hit all my points here, guys. Yeah, so an extension of telecare, because right now we have it over the phone, but what if it was over a hologram, right? Maybe working on, I'm so sorry, guys. I have to collect my bearings. Yeah, maybe working on AI avatars and working at that idea of using AI avatars and extrapolating that to more of a realistic environment. So again, helping autistic individuals with socialization and putting them in a spot where that's fully artificially made so that they can start to thrive in. So, if we're given this space to sort of change the realities of ourselves, what if this space also gave freedom to also change the way you look? Also change the way you're perceived to others. That can help with a lot of euphoric feelings. So sometimes you don't feel, sometimes people look one way but don't feel that way on the inside, and that can help if we had a metaverse world in order to change our appearance and do that sort of thing. And so I have a little reflection question. If we're able to do that, kind of change our environment and also change the way we look and are perceived to others and maybe to ourselves, do you think in the future there's going to be this idea of normal? Because in a way, we can all kind of change the way others look and to change the way we look. So will there really be judgment in that regard, and also for people who are neurodivergent? So in this world where we have the ability to change our surroundings from one perspective or change the way we are perceived to others, and if everyone's perception of the virtual space would be different, would there be this idea of normal? Would there be a shared reality, or would we be kind of interacting through entirely personalized worlds? Does anyone have any comments on that? Go ahead, Daniel.
I kind of get what you're saying with that question. I think for me, when I think about having a meta kind of world, I think about the fact that maybe there wouldn't be a normal, but there would kind of be a standardized kind of set of things that people would pursue. I think in reality, a lot of people have insecurities, right? And if we're thinking about neurodivergent individuals, if we're thinking of someone who maybe has autism, maybe they don't like eye contact, but maybe in that world they can correct that, right? And so in a perfect world, maybe everybody is making perfect eye contact with a different person, right? Or never speaking, having no speech impediments, right? Or speaking with only the most perfect type of clarity, right? With the perfect type of pitch, that type of thing, the perfect pace. So I feel like that's what it would look like. Everybody, if they have the opportunity to, everybody will just try to make themselves perfect, and so everything would kind of just be standardized to what everybody sees as perfect or beautiful.
That's a really good point. Does anyone else have any other comments for that? Oh, go ahead.
I guess there may be a different perspective where I think the definition of normal could be more diverse. So, for example, if the normal right now is to make eye contact, but whenever possible, maybe in the future, we don't even need to make eye contact, something like that. So maybe the definition of normal could change.
Does anyone else have any other comments?
I think maybe in the future because as of now, the definition of normal is kind of a group consensus, right? It's kind of what the group thinks is what should be done, what is considered quote unquote normal. But I think possibly in the future, it will be subjective, especially in something like the metaverse. It's what your settings are, what you personally see as normal. That will be normal in your world, in your perspective, in your worldview. It won't really matter what the group thinks. Essentially, it kind of will shift to what you think is normal.
So when AI is smarter than we are, more clever, tells better jokes, is more entertaining, has broader knowledge than we do, and so on. They're coming from a non-biological beginning, right? So, they can be anything that they want. So I think that's going to create a lot of freedom for us, because there'll be AIs that you respect because they're able to do all sorts of things you can't do. And so you might either be inspired that you want to look like them, or you're just thinking that you want to be as different from generic humans as they are somehow, right? So I think and you can't predict future trends and things, but it seems likely that will be so. Right now, we're assuming that when you fall in love with something, it will be a biological something, right? But maybe the world will change so that it's much more likely that you would be attracted to a sort of artificial being, right? Yeah, so many things will change, I think.
Okay, these are my references a lot. Thank you guys for your attention. Any questions?
I have a question.
Yeah.
Don't you think that putting a VR might increase the isolation of the person? Because you want to create a personal space, but if a person already feels isolated because he cannot create contact because of the situation or the difficulty that the person has, putting on VR and create his own world, it might,
Yeah, I also can add something to that. So, like the majority of the therapies which we use to overcome the challenges of being autistic is like cognitive behavioral therapies, group activities, having good parenting, peer support. So these are like a lot of community support, peer support, and family support, and it's not isolated. So someone is using VR or anything which traps them inside. I don't know like what will be the outcome because it's like more like going from isolation to isolation,
Like
right?
a deeper isolation.
Yeah.
Unless we all put a VR and we join the, like, I don't know if you meant that everyone is putting a VR and then we create a new world where everyone is in the VR and then we change completely the world and we are all having an interaction and we change basically the basic rules of the human interaction and it's a virtual interaction like when we are playing video games.
Yeah.
Because otherwise it will become a little bit different and you have to change the interaction that you're asking the person to do, and with a VR it might help him or her, but at the same time you're asking him to increase the I don't know, the isolation.
No, I think there's two aspects of this question that I can really like focus and talk about. So currently the adaptations of VR are really just to, you know, help autistic individuals in a more constructed and controlled space and then use those skills in the outside world. But yeah, like in the far future, what if, again, we are all to wear VR headsets and to, you know, communicate with each other? So it's both of your responses, and I totally understand like that can cause future isolation, which is kind of one of the cons I talked about. So the hope is that currently if someone was to wear a VR headset and to be put into this artificial controlled space, they'd be using those socialization skills and build more confidence and then talk to real people. But yeah, again, like in the future, what if we're all wearing VR headsets, right? And sort of our interactions are more facilitated, right? I hope that answers what you're saying.
Yeah,
Yes, okay.
Yeah, and the app is designed to like diagnose autism. Like, is it used to diagnose autism?
The Canvas DX software is used to diagnose autism, yes.
Okay, so yeah, the like the question is like statistically 85% to like 93% like that autistic disorder or the autism spectrum disorder is diagnosed before the age of 5.
Yeah.
85% is like before the age of 3. So I think adult diagnosed autism is around like 10%. So earlier the better. So like who is the like if they diagnosed autism in the age of 3, so who is using that? The parents are using that, or?
So I'll just go back to the slide that we're specifically discussing about. So there for this specific software, they focused on children and they focused on information coming from parents or caregivers through videos of them playing and a questionnaire that they give them, and also healthcare practitioners. I don't know if that really answers your question. Okay, so it gives the results to the parent through this software, through this
It's like
yes.
like caregivers, parents and doctors, like everyone is there, right?
Yes,
Because
both of them
there
are
are like
involved.
self-diagnostic apps, right? Like you can fill up a questionnaire yourself and
Yes. Yeah, but this is through like a control software, so I hope that.
yeah.
Okay.
Great.
Thank you.
Thank you.
Thank you
Okay.
guys.
Okay, so Jessica or Dawn or who?
Yeah, I can go.
Okay. Set
I'll
up.
just stop with this. I talk too fast. I realize that now. I always do that when I do presentations. It's already after, not great. So it was nice.
Can I borrow your
We'll see.
thing? Oh.
Oh, go ahead. I'll just do it afterwards. Does anyone else want a candy? Okay. Daniel,
That's about
you
it.
took one. You guys can take more than one. There's a whole bag. Go ahead.